Okay, everybody, hello, and how are you doing? This is going to be a kind of off the cuff training. I am right in the midst of doing my Medicare enrollment certifications. I'm going to start off here with United Healthcare, and they have a new website called Jarvis. It used to be UnitedHealthProducers.com, but they've changed it over to Jarvis, and that's found at www.uhcjarvis.com, and this is where you go in and log in. So I always recommend, if you're stuck, to call the producer help desk with United Healthcare, and that phone number is going to be, and I'm going to tell it to you right now, the number is 888-381-8581. That is the producer help desk. They are a wealth of information. So this is actually going to be a quick, like I said, spontaneous training so that you could see exactly what it looks like to go in and do your certification so you can write Medicare Advantage plans. Let me just say this about that. In terms about the plan choices, a person would have a choice between Medicare A and B and a Medicare supplement, and that would be one way to go. And that would look something like this right here. And so you have Medicare A and B and D for the drug plan, standalone, PDP, and then the Medicare supplement. This is the way I started out. This was the only way to go back in 2001 until 2005, when they introduced Part C Medicare, and Part C has the Part D embedded in it for free, and these plans are typically zero premium and or a small premium, and they're major medical plans with an HMO. Different than the Medicare supplement, which is a PFFS plan, and it is designed to pay for all the leftover copays and deductibles that Medicare leaves behind. That's just a quick little reference to the Medicare. Now, when it comes down to the chart that you would want to reference, now this chart shows the 10 standard Medicare supplement plans. And this is not Medicare Advantage plans at all. The Medicare Advantage plans are actually governed and regulated by CMS, Centers for Medicare and Medicaid. A Medicare supplement would have A and B with working with it, and then these plans, the best plan would be the F plan, and it has 100% of coverage on everything. And then you have these new plans that came out in 2010. These four plans came out to replace the earlier plans that were outdated. And then you can notice here it used to be sequenced A, B, C, D, E, F, G, H, I, J, and now they've changed it all around since 2005 and 2010. So these are the Medicare supplement plans, and we'll go into more detail and training about that. Now we're going to sign in to Jarvis and show you how you need to go through Jarvis to save $50 when you're doing your AHIP certification. AHIP is to certify for the Medicare Basics. And so now we're signed in to the United Healthcare portal, and this window will load, and now you just click on Launch Now, because it's saying United Healthcare certification is now open. Certification season is here. Be sure you are prepared for 2018 selling season by certifying early. Save up to 60 minutes with streamlined modules. So they have revamped it from a number of years that we were doing it a certain way, and this year it's a new approach. So this again is going to load up a new page to move on to. And that's this page here. So it says, our certification courses will educate you on Medicare compliance and Medicare health plans, giving you a strong foundation for making sales presentations, conducting meetings, and helping Medicare eligible consumers make the right choices. Certification resources guide you can read, and this is for 2018, and certification resource guide as well. I recommend you download those and read them if this is your first time, second time, third time. For me, I've read them before a number of times. So here now I'm going to launch certifications. Now for me, earlier today, I had called United Healthcare to make sure that I was getting in here correctly in through the portal. And what I did was click on the link into AHIP. So these are the certifications at the top left corner, and I am doing this not through my corporation because a corporation can't do certifications, but I'm doing this through my own personal ID number. Now right here where it says 2018 AHIP, I'm going to do it. I'm going to do it, and let's see if it goes into AHIP. And I click OK. You have 6 attempts to complete this component. OK. And then so you get 3 attempts for each certification questions. But here now, I'm going to launch the AHIP 2018 POW, and it takes me into AHIP. Now AHIP, it's insurance education, and my obviously my login is saved. I'm going to click it, and this is your Medicare side and fraud, waste, and abuse. And you would do the registration here, create a new account if it's your first time. But as you go back, you just log in, and I've had an AHIP login for years. Now the first time before I even hit here, or when I came here, I had to pay $125 for this training. That would be the $50 discounted. It's typically $175. So as I go ahead and hit continue, it's going to take me into the courses, and I'm just going to do this to show you quick little video about how you get started on this, and then I'll leave you to it. Now you can see here's my account, and I've already been in here, and I clicked on the 2018 Part 1 overview of Medicare programs, basic choices, eligibility, and benefits. So it says in progress. You can see hanging on around the hand. And AHIP's Medicare fraud, waste, and abuse training component requires successfully completing of AHIP's Medicare training final exam, which is not too hard to pass. You know, it depends, but you got to study it. So I'm clicking on the first training module, and here it starts out. Medicare, original Medicare has parts A and B. Medicare Advantage plans are part C and D. So everything you need to know about Medicare, and I've sent you trainings about that. You should have had some introduction to Medicare with the video trainings that I've created, and this is going to be really as well solidifying that. So it's really, really good that you have had some other training videos to start off with. So for example, and it goes through these examples about clients and scenarios and case studies, and I'm hitting next, and it's going to continue on to the next page, and it explains as I have, and you've seen on my tabletop presentation, and I go through explaining all this. This Part A, hospital, skilled nursing, hospice, and home health care is the only thing that Part A covers is hospitalization, and Part B, professional services such as those provided by doctor, non-physician, professional, outpatient, outpatient surgeries, ER, and other medical services. So you go on. That's just told me that information, and now I go on, and it's going to go page by page, highlighting and training you about all the things, nuances of Medicare. See Part 2, Medicare Health Plans for more information. We're moving on, and it'll cover Part 2. And you can see their private fee-for-service plans. That is what Medicare is, with no networks. So here are other types of Medicare plans. Medicare cost plans, we don't have those in California or Utah or any of these western states, never had them. PACE plans, we don't have those. Medicare, Medicaid plans, we do have those. Those are for dual eligible people on Medicare and Medicaid can have a Medicare Advantage plan designed specifically for people on Medicaid or Medi-Cal, and that would work in the place of Medicare, a Medicare Advantage plan with the drug plan embedded. So a person on Medi-Cal and Medicaid or Medicare, they would be eligible for us, and on a monthly basis, they don't have an open enrollment. You can enroll them into a dual eligible Medicare Advantage plan anytime throughout the year, and that's an awesome thing. If you're one of those people, you can make some money. And then we go on to these other pages: standalone, Part D, prescription drug plan, and examples. I am not, going through this on a slow pace. I'm showing you slide after slide and showing you what it looks like if you're going to, do a study of each page. Now here's your, including the annual maximum out of pocket MOOP limit on total enrollee cost sharing, deductibles, copays, and co-insurance for Part A and Part B services. Original Medicare does not have such a cap. That's right, because Medicare is not catastrophic. They have no cap. And that's why people want to have extra help, extra benefits, Medicare supplement, or replacing A and B Medicare altogether and getting Part C. So you're actually replacing A and B with Part C. That major medical plan is all you need. And so we go on and continue. So here's actually Part C, Medicare Advantage plans continued. They can offer, sometimes do offer, extra benefits such as vision services, hearing aids, routine dental services, or dentures. Routine transportation to medical appointments, that's often maybe 12 to 24 one-way trips a year, that they can have free transportation to medical appointments. Chiropractic services have been introduced. They're only a $20 copay for your client to go to the chiropractor. Annual physical exams, in-home safe assessments, worldwide urgent need, and emergency services or over-the-counter drugs are all the added benefits that are not with original A and B Medicare, but only with C Medicare or Medicare Advantage plans. And the annual physical, Medicare does not give anybody an annual physical only the first year they're on Medicare A and B, and then after that no more annual physicals, except Medicare Advantage plans do give an annual wellness visit covered. Medicare does not include the physical exam, but the Medicare Advantage plan does on an annual basis at no charge. Medigap Insurance, that's the Medicare Supplement. They wanted to change the name from Medicare Supplement to Medigap. So keep that in mind. It's the same thing. I'm saying more and more nowadays Medigap because that's what they want us to say. You can see how they have the name here in it, and then the Medicare Supplement is in parentheses. Okay, so these are sold by private companies. They work well with original Medicare and covers all or a portion of Part A and Part B cost sharing. And so here we attempt the quiz. And as we take this quiz, it goes along as checking your learning. So I will do the quiz. Mrs. Moore plans to retire when she turns 65 in a few months. She is in excellent health and will have considerable income when she retires. She is concerned that her income will make it impossible for her to qualify for Medicare. What could you tell her to address her concern? A. Medicare is a program for people age 65 or older and those under 65 with certain disabilities, end-stage renal disease, Lou Gehrig's disease. She will be eligible for Medicare, and I think it's that one right there. And then, or the answer could be eligibility for Medicare is based on whether or not a person has ever been employed by the federal government. Is that right? No. Number C, Medicare is a program for people who have incomes and assets below specific limits. So find out her exact financial situation before telling her whether she can obtain Medicare. Now that sounds like a description for Medicare and Medicaid or Medi-Cal. So that's not it. And then D, Medicare is a program for people of all ages with specific mental health disabilities. Wow, that means a lot of people. Since she is in excellent health, she would not qualify, but should instead look into her state's Medicaid program if she wants further coverage. That's a no. So here's the second one. Mr. Schmidt would like to plan for retirement and has asked you what is covered under Original Fee for Service FFS Medicare. What could you tell him? So we have first choice A, Part A, which covers hospital, skilled nursing facility, hospice, and home health services, and Part B, which covers professional services such as those provided by a doctor and covered under original Medicare. Now that sounds exactly like the one we read earlier on an earlier slide. But let's check. And then the B, Part C, which always covers dental and vision services, is covered under original Medicare. No. Part A and B is original Medicare. And that's their fee-for-service Medicare, is what we're trying to answer. So, number C, Part A, which covers long-term custodial care services, is covered under original Medicare. No, they are looking for more coverage than that, which is the first answer we will check. And the Part D, which covers prescription drugs. Well, that's just isolating Part D, but that's not part of, and that is not a fee-for-service plan. So there we are. That's the right answer. Number 3, Mr. Hernandez is concerned that if he signs up for Medicare Advantage plan, the health plan may, at some time in the future, reduce his benefits below which is available in original Medicare. What should you tell him about these concerns? Okay, starting with A, Medicare health plans offer a menu of benefits from which he may choose. So if he ever wants to increase his coverage, he need only contact the plan and select other options. And that is not how it works. So B, Medicare health plans have the option of deciding each year what services they will cover. He is correct that the health plan could eliminate some benefits covered by Medicare, and he should think carefully before enrolling in a Medicare health plan. I'm going to say that's a possibility. C, Medicare health plans must cover all benefits available under Medicare A and B. Many also cover Part D prescription drugs, and that's a possibility. Boom. He should not be concerned because Medicare health plans must cover all IRS approved health care expenses, which means that all of them provide substantially greater benefits, and that's a no. So we're between the middle two. Okay, so I think that it's the C, and I'll tell you why. It has been in other tests said that the Medicare health plans, that's Part C and D, has to cover all the same benefits that Medicare covers, Part A and Part B, and do better than that. So a Medicare Advantage plan, actually, if you would look at that, it is better than Medicare alone. And we're only comparing a Medicare health plan with Medicare A and B alone, not with a supplement. So on this C, Medicare health plans must cover all benefits available under Medicare A and B. Many also cover Part D prescription drugs. That's true. Okay? And we're talking about Medicare health plans, which are Medicare Advantage plans in that. Which of the following statements provides the best advice for Mrs. Raskin, a widow who will be turning 65, going on to Medicare in a few weeks? Okay. A, comprehensive prescription drug coverage is now included under Part B Medicare. No, not all. Comprehensive prescription drug coverage is offered by all Medicare Advantage plans. That's no. They're not all. There are Part C plans standalone and not a Part D embedded in it. Prescription drug coverage can be obtained by purchasing Medicare Supplement and Medigap F policy. No, that's only buying a Medicare Supplement. The Part D is not included. That's a separate cost. Prescription drug coverage can be obtained by enrolling in a Medicare Advantage plan that includes Part D coverage, and that is correct. Mrs. Willard wants to know generally how the benefits under original Medicare might compare to the benefit package of Medicare Health Plan. Before she starts looking at specific plans, what could you tell her? And this will be a similar answer as to what we had above about how the original Medicare might compare to the benefit package of a Medicare health plan. That's the Medicare Advantage plan. So original Medicare compared to a Medicare Advantage plan. Okay, so Part A here it says Medicare health plans do not necessarily have to cover all the original Medicare Part A and Part B services, but must include a maximum out-of-pocket limit. That's not true. They must cover all of the A and B services. Medicare health plans are not permitted to offer any benefits beyond those under the original Medicare program. Also not true because they actually do include other benefits like dental, vision, and etc. The wellness physical annually every year is an additional benefit that original Medicare A and B does not have. So it's doing a better job than original Medicare. Medicare health plans may offer extra benefits that original Medicare does not offer, such as vision, hearing, and dental services, and must include a maximum out of pocket, and that is the golden ticket. All Medicare health plans offer cost sharing that is lower than original Medicare for all A and B covered. But the maximum out of pocket limit is higher than original Medicare. That's not true because Medicare is not catastrophic. It has a lot higher maximum out of pocket. It's unlimited. It takes the money from the client and leaves all the rest of the money for the client to pay after a certain point. That is not catastrophic coverage. Mr. Mioni's wife has a Medicare Advantage plan, but he wants to understand what coverage Medicare supplemental insurance provides, since his health care needs are different from his wife's needs. What could you tell him? And I have clients who have, one has a Medicare supplement because she's very ill and on the verge of really dialysis on her kidney, and the guy is very healthy, so he has a Medicare Advantage plan and she has a Medicare supplement. It's what is going to be the best fit for them. So in this situation, he wants to understand what coverage Medicare supplement insurance provides, since his health care needs are different than his wife's. What should you tell? Tell him Medicare supplement insurance would cover his dental, vision, and hearing services only. That's not true. B, Medicare supplement insurance would help cover his Part A and Part B cost sharing in original fee-for-service Medicare, as well as possibly some services that Medicare does not cover. And that sounds like a good possibility. Let's just do whittle it down. So the third one, C, Medicare supplement insurance would cover all the IRS approved. Absolutely not. Medicare supplement insurance would cover his long-term care services. So I'm saying that it's Medicare supplement insurance would help cover his A and B cost sharing. That's right. Supplement pays for the A and B copays and deductibles in the fee-for-service Medicare, as well as possibly some services that Medicare does not cover. They will come in, such as the 365 lifetime reserve days that Medicare supplement provides after the 150 days have been expired. So let's submit all and we'll finish up here and see what it looks like. It's going to give us our answers right away, if it is going to be like all the years in the past. Okay, let's see how we did. These questions here, we got that right. Got a green check. We got this one right. We got a green check. We got this one right. We got a green check. We got this one right. We got a green check. And this one right with a green check. And this one right with a green check. So that tells us we know our stuff, and you will too. So that's all for me now. I'm going to just sign off and we'll put this out to you so you can see exactly how you can get certified with your AHIP, and then after that you would go into each individual carrier portal and learn their specific products for their product training. But your AHIP we're doing right now is going to be able to be uploaded into each one of those portals in each carrier so that you get this one test qualifying you in all of those carriers and knocking down that basic Medicare benefit testing requirement. And just to add to that, since I kind of left that open, you would do all these modules. This is only module 1, But to complete all the AHIP, there will be other modules that you would have to do. As you saw in the beginning, we started with the first one and there were 3 other ones. So you will be able to, complete this training through once you're done with all those modules and the final test. Thank you very much.